Before I start my remarks, to those of you in the media who are familiar with this, you're going to get my daily update on what's going on with respect to tests and hospitalizations. Yesterday, over 10,000 tests were reported, with 519 of them confirmed positive. The average positive test rate on that 7-day average, running average, is now down to just 3.8%, reflecting about an 87% reduction in the number and percent of positive tests since April 15th. That's obviously continued good news, and more than 675,000 individuals have been tested for COVID-19 across the state. The number of people who remain hospitalized due to COVID-19 is down to 1,334. That's a 63% reduction since the middle of April. And obviously these trends are the direct result of the work's been done by the people here in Massachusetts to distance, to wear masks or face coverings, to wash their hands, to clean surfaces, and to recognize and understand the importance of respecting the virus. I also want to say that over the course of the past several months, every day, the Lieutenant Governor, Secretary Sutters, and I have been on phone calls with Dr. Tabb and his colleagues at the major hospital systems across the Commonwealth. Every day since about the end of March, we had a call every morning to talk about the state of play with respect to the surge and managing COVID here in Massachusetts. And I was saying earlier to Secretary Asar that one of the most important elements of our success in managing our way through that process was the willingness of the hospital community and the healthcare community to basically break down a whole series of institutional relationships and to find a way to collaborate and work with one another to make sure that the right bed was available at the right time for the right person, irrespective of what system they started in, what hospital they came through, or whose ED they entered. And over the course of literally 8 weeks or so, as we managed our way through that surge, the hospital community here in the Commonwealth, this hospital, all the hospitals that are part of the BI Leahy system, and so many others really stepped up in a big way to make sure that they could not only manage and serve the COVID population that they were dealing with, but that they would also have the ability to take care of the other crises and traumas that people were dealing with on a more traditional basis with respect to healthcare. Which brings me to my second point. These numbers have gotten to the point where basically the entire healthcare system in Massachusetts is out of surge, with very few exceptions. And it's critically important, as we have opened up the healthcare system once again in Massachusetts to do other things, that people who need to access preventive services, diagnostic services, minor procedures, or simply reach out and go back and get their kids vaccinated or have that mammogram, that they do so. It's critically important that everybody understand and recognize that we have a healthcare system here in Massachusetts that's looking to serve people, has the capacity to serve people, and with the advent of telehealth visits, in many respects has more tools available to take care of and serve people than they did in some ways before all this began some 150 days ago. The third point I want to make is we also talked upstairs about some of the work that's being done here at this institution and at other institutions here in Massachusetts, some of which is in fact federally funded, to chase a vaccine with respect to COVID. And I think it was announced yesterday that the feds are moving forward with a clinical trial process that will start in July, but there's a very promising platform that's been developed here at BI in conjunction with Johnson & Johnson that can, in many respects, provide a significant amount of optimism to all of us who are looking for both treatments and vaccines as a big part of how we, not only here in Massachusetts, but around the country and across the globe, deal with COVID-19 as we go forward. And the final thing I have to say is that my wife and I have 3 kids. They were all born at this hospital. And our oldest, when he was born, it was like many first deliveries, it was a little complicated. So when we left, one of the nurses in the nursery gave us a phone number and said, if you have any issues after you get him home, feel free to give us a call. And after 6 or 7 hours of being a parent on my own, I felt it was time to call. He felt a little warm, and I was worried about him, so I called the number they gave us, and they answered it in the nursery, and I said, geez, you know, I think he's got a fever. I really think I need to bring him back in. And the nurse on the other end of the line said, so how many blankets do you have him wrapped in? So I started peeling them all off, and I said, I don't know, 4 or 5. And she said, I'll tell you what, why don't you just take the blankets off, lie him down, and see how he's doing in 30 minutes. And that was, in some respects, my introduction to what I would call genius with respect to healthcare here in the Commonwealth and at this institution in particular. It's a great institution. It's one of many we have here in Massachusetts. And Secretary Asar, I just want to say to you, there is no better place in this country to come learn about what's going on with respect to COVID, with respect to treatments, with respect to testing, with respect to vaccines, and with respect to care than right here. And we really appreciate your being with us today. Thank you.